Hi, ladies and gentlemen. My name is Ronak, Bharucha, and I'm currently a first-year general cardiology fellow at SUNY Upstate Medical University in Syracuse, New York. I have the distinct honor and pleasure of introducing Dr. Stephen Gottlieb. He's a world-renowned cardiologist and professor at the University of Maryland. Thank you so much, Dr. Gottlieb, for joining us today. In anticipation of his expected trial on the preoperative treatment of Digifab in post-operative patients who are at high risk for developing acute kidney injury after coronary artery bypass grafting, we'll kind of essentially take the next few minutes to kind of talk about that topic. Dr. Gottlieb, once again, thank you for joining us. If you wouldn't mind just kind of sharing with us some information about your trial, that would be greatly appreciated.
Happy to. Glad to be doing this. So it's first important to understand endogenous Wabane. There is a neurohormone, corticosteroid, that most people don't know about. That is endogenous Wabane. It works on sodium, potassium, ATPase. It's related to digoxin, but it is not the same. It has varying effects. It turns out that sodium, potassium, ATPase has subunits. It has isoforms. It's on many different types of cells. And all of this interacts in very complex ways with high doses, high levels and low levels, having different effects under situations of hypoxia or not hypoxia. And that being said, there's also evidence that Wabane may cause real problems on the kidney, especially perioperatively in the acute problems, the acute stresses that happen at surgery. So we did a study looking at the effect of Digifab, which of course blocks digoxin toxicity, but also blocks endogenous Wabane, to look at its effects on renal function.
Awesome. Thank you so much for that. I guess, to begin with, how did you even stumble upon this, Wabane, and the association between that and Digifab?
Well, I've been at the University of Maryland for a very long time, but there have been people at the University of Maryland there longer and working on endogenous Wabane for decades and decades.
Wow.
So it's always been in the background, and seeing that there are potential effects on the kidney. And I'm a heart failure trialist, and have been involved with cardiorenal syndromes for a very long time. And while this is not heart failure, it kind of fell naturally in what I do.
Very nice. I did have another question, and that question is that how do you think that this will affect the recovery of those patients, especially those who are at high risk after getting coronary artery bypass grafting?
Well, we haven't talked about the results yet, but I will say this was a study of 250 patients,
okay,
and didn't really have the power to conclusively decide anything. The point of doing this study, which I have to say was fun to do, was to see if it really makes sense to spend the millions of dollars that it takes to do a conclusive study. And just based upon the number of people, the relatively few patients who would develop AKI, and assuming that you're not going to prevent all AKI with any intervention, clearly I am hoping that people with the money will now see that it's worth spending it for something that might really be beneficial.
Dr. Gottlieb, so I did have one question for you, and that was in regards to the, how this affects those patients who undergo coronary artery bypass grafting. What did you see with your results as part of your trial?
So we saw is in a predetermined analysis of people with an endogenous Wabane greater than the median,
okay,
that blockade of it with digoxin decreased the incidence of AKI, with 12 patients on placebo developing AKI and 5 patients on Digifab developing AKI, and this was statistically significant.
Wow. Wow. Amazing. Amazing. I'm sure our nephrology, partners will also be very fascinated by the study as well.
My son is a nephrologist, and yes, we actually have something in common here.
Well, that's awesome. Once again, thank you so much for joining us. And be on the lookout for that trial being released at 1:30 p.m. today. For more videos like this, please check out our channel at youtube.com/FITsOnTheGo.